Hello, everyone. I see quite a few people signing in right now. This is the COVID-19 open call from Superior Health Quality Alliance, and we'll be getting started shortly. Just wanted to let you know the name of the call that you just signed into. So I do want to get started right. Okay. Let's see. Yeah. Well, it is 10 o'clock, and I know we had quite a few people register for this event today, but just to be cognizant of the amount of time we have, I think I'll just get started right at the top of the hour. I know people are still signing in, but I think to make the best use of our time, I will get started and also provide you some housekeeping information and information for follow-up, but then we will get ready for our open call today. I just want to give you a heartfelt thank you for all you're doing right now, given the situation, the unprecedented circumstances we are currently in regarding our healthcare system and the quality of care you all are providing for our patients. I cannot thank you all enough, and thank you for taking the time today to be a participant in this open sharing call. This call is provided by the Superior Health Quality Alliance. This is a quality improvement organization, umbrella organization that includes MPRO, the QIO from Michigan, Metastar from Wisconsin, and Stratus Health, also another QIO quality improvement organization from Minnesota. We also have the Midwest Kidney Network, and then the hospital associations from Michigan, Minnesota, Wisconsin, and Illinois as well. So we have participants from all of those states today. We have a cross section of healthcare environments and people who support patients. And so we hope that this is a productive and helpful discussion to share information on a regional perspective. Just very honored today. We've had over 300 participants pre-register for this program today. And so there could be a possibility that you do not get your question answered. Please put it in the chat, and if not today, at a future call, those questions will be setting the agenda. We are trying to also get out the most pertinent and factual information to everyone. So we are going to continue to be a source of agency to try and provide that information to you in this ever-changing healthcare environment. So with that, I want you all to know that this session will be recorded for future use. So if someone you know couldn't participate today, it is recorded, just so you know that as well. We do appreciate that you put your name, organization, and your role at that organization in the chat box. It also would be very helpful to state the state that you're from, say Michigan, Wisconsin, Illinois, or Minnesota. If you could please mute yourself when you're not speaking, we would also appreciate that. That will limit background noise. And do not disclose any personal health information. Please keep anything that you give in as example very generalized. Elena Smith is our co-host today. She'll be managing the Zoom as well as the chat box. So if you're having any issues, please put it in chat and she will try and assist you. And if you have any other questions or comments, please chat them in, and so that all the members can see them and we can address your question. So at this point, we did have some people write in about certain things regarding concerns regarding hospice patients. the continuum of care, transfer of patients. The last time we met, it was just a small group, sort of trial run that we had, and we talked about a universal transfer form that was being developed by the Michigan Hospital Association. Those are some of the things we could talk about today. I've also invited someone from the telehealth world as well as EMS. So if someone would like to state a question, or if Elena, you have a question already in chat, maybe you could say that for open discussion.
I haven't seen any questions come through the chat quite yet, but if you feel more comfortable adding it there, feel free to do that. Just make sure that when you are asking questions in the chat to address them to everyone so we don't miss anything. Thank you.
And just a reminder, this is your forum. We are seeing that these conversations taking place from the continuum of care have really been incredibly productive. So if someone feels comfortable in introducing a question so others can provide their area of expertise or their experience, we'd appreciate that now. So the forum is now open.
We have gotten one question in the chat so far. Can you please provide info on where to obtain the proper PPE from Darla?
So we do have some resources that we could send out after the conversation regarding state-specific areas where you can obtain PPE, but if anyone has any suggestions now from your particular facility, we would welcome them at this point as well. Oh, it looks like Megan Black is saying that one SNF in their area contacted local schools and let's see, that are closed to get their thermometers and probe covers. And yes, you certainly at this point, Sarah, you could respond verbally. That would be great. You can open up your line and speak. Sarah Blackstock, I know you're from ABF Home Care. Do you have some input?
We have received emails from Vercelli, I think it is, and they sell them at minimum of 1,000, but the N95s are FDA approved. They're not NIOSH approved, so I don't know about getting the N95s from them, but they have gowns, face shields, and regular surgical masks as well. I can send that to Barb, and Barb can send it out to everybody.
Great, thank you, Sarah.
There are a couple other questions in the chat. Would you be able to provide info on if we can use cloth masks in LTCF? And if so, what are the specifications, type of cloth, pattern, etc., and where we can get the approved pattern? Thank you.
And again, I think we could certainly send out those specifications, find some information for you afterwards and send that out to everyone. If anyone has any thoughts on that, we're happy to discuss that now, but we can also send out that specific information and links to those as well. And Gloria, if you would, Gloria Ray, I'm happy to have you say your specific question to the group. Would you like to state it outside of the chat?
Hi, can you hear me?
I can.
Hi, this is Gloria Ray. I'm from Henry Ford Health System. I'm just wondering how other organizations are starting to organize their thoughts around code status and DPOA with their current residents.
And again, if you feel comfortable opening up your line and saying it out to the whole group, we're happy to have you do that as well.
This is Megan. Can you guys hear me?
Yes.
Gloria, I'm curious, are you talking about like the public at large? Are you referring specifically to skilled nursing facilities or actually in the hospitals?
Anybody who is willing to share at this time, I would be willing to hear from. I've already asked our partnering home health and SNF agencies to look at their current DPOAs and start talking to families about their wishes with their loved ones. I was just wondering in general how everybody is coping with that need.
So we just recently started working out, so I work for the health system, for context for everybody else on the call that doesn't know me, and we're working with our preferred provider network of skilled nursing facilities to try to find out how they've adapted their conversations during advanced care planning and code status stuff to incorporate specific information related to COVID, especially because of the vulnerability of that population. I do have links to a couple of resources that actually our emergency department medical director sent over, so I'm going to take a few minutes to dig that out and put it in chat. But basically, it's really important at this time to talk about whether they, because DNR is traditionally what you're mostly looking at, but making sure you have pretty thorough conversations about intubation and ventilation, because that's obviously something that's a little more invasive than people may think at first. So we're still working on that. There are a lot of guidelines that, or a lot of publications that came out from CDC in the last 2-3 days, and we're trying to make sure that the language that's reflected in there preparing skilled nursing facilities to eventually have to take COVID positive patients as well are incorporated. It's just a lot, which I'm sure you all know. So I will go ahead and try to find those documents and share.
Thank you, Megan. I do see one about telehealth. What applications are providers using if newly implementing telehealth? Have you obtained a BAA, even if HIPAA enforcement is waived at this time? And do you document any type of consent from patient? And does anyone have a policy to share? Anyone have anything that they'd like to talk regarding the parameters of telehealth? And again, at this point, if you'd like to open up your line and discuss it, it's fine as well. I know I invited some different people in the area of telehealth. If they would like to speak at this time, that's great too.
Someone in the chat said that they have heard many providers are utilizing Zoom, what we're using right now.
Okay.
Doxy.me is HIPAA compliant. You will need a BAA with Zoom. From Cheryl.
Okay. And I'm just curious to know, have any home health agencies, I saw, I know Donna Filer and I know Eric Wilson, if either one of you would be willing to speak, how have you been managing telehealth on the home health care front? Have you been able to expand it? And it would be great if you wouldn't mind actually opening up your line and saying a few things.
This is Eric. What we're trying to do from the, obviously we're utilizing the waiver obviously with the telehealth, and so what we're trying to do is coordinate those, because a lot of the patients in the home environment don't have the capabilities to FaceTime or Skype with their physician. And so in coordinating whether it's a face-to-face visit or whether it's a follow-up visit because something's wrong, we're trying to coordinate the social worker or the home health aide to be at the patient's home to facilitate that face-to-face telehealth visit so that the patient can have the access to it with the help of someone who's knowledgeable in using the device. So as far as the compliance, like we've never ventured in the virtual space, for the telehealth, for the face-to-face things. So maybe Donna has some more to add on that, but typically more of the telehealth is with the devices that we use for the blood pressures and the temperatures, etc.
Yeah, Eric, this is Donna. We do at Great Lakes or Alara Caring, we have a telehealth we have a telehealth device we're using, which allows us to FaceTime with our patients. So those patients that have the telehealth unit in their home are definitely utilizing that right now. Our senior management is working very closely in coming up with another virtual visit option for us for our patients. I don't have any other further information on that right now, but I should have that within the next couple days to a week. And I know that we are now across the board with 16 states. So they are working with the appropriate authorities to make sure that we meet all the compliance necessary with those virtual visits. So I hopefully we'll have some more technology we're going to be using shortly on that. But our current technology is our telehealth unit out in the homes with many of our patients that we can FaceTime with our patients with that unit.
Thank you. Anyone?
Megan Black.
Yes.
Megan Black shared a resource in the chat on some things that might help in discussions of advanced directives in COVID. So she included those in the chat if you're interested in learning a little bit more about that. And looks like one of them is a PDF. We might be able to send that out when we send out our information.
Okay. I do know there was a question beforehand that was sent in asking about hospice patients and how skilled nursing facilities are handling that situation. Does anyone have any concerns or any suggestions on specifically management of hospice patients at this time? And especially, I guess it was if they do screen positive for COVID-19?
Hi, this is Cheryl from Rural Wisconsin Health Cooperative, and I was the one asking for some of our members that sent in the questions. So the concern is, are any other places taking on new home hospice patients? That's one part. Are you admitting them into the hospital? What happens if they're positive for COVID-19 and they're on hospice? Anything else you have? And the only resources they have for hospice right now is from the Home Care Hospice Association. So just checking if anyone else had anything.
Thank you, Cheryl. Thank you for clarifying that.
Absolutely.
Again, and if you feel comfortable responding verbally to Cheryl, that's great. Or you can put the information in chat. And you can also do some research too.
Thanks, and if you have any information, I'll throw my email address in the chat box in case you don't want to speak up on that as well.
Thank you.
So this is Angie from Fairview Range up in Hinney, Minnesota. So I think from a hospice perspective, what I'm seeing is that we are still transitioning patients to their home and allowing for that. We have had hospice visits on the inpatient side. We have not had any COVID positive patients, however, and so our demographics may be a little bit different right now, and our census has been low, but we continue to support that workflow. I think the transition into a long-term care facility with any positive patients is going to be an extreme barrier for us here. And so we are planning for that. Those patients most likely will stay in the hospital.
Thank you.
There is another question in the chat. Are there any life safety code violations by installing a clear plastic zippered entrance to each COVID positive room?
And again, we certainly can try our best to find an answer to that if no one on the phone line has any input into that area. Okay. And
I'm guessing this is a follow-up to that. Someone said, would there be a safety risk with possible code situation? So another thing to think about.
okay. All right. Let's see.
There's another question in the chat, and this one is to SNFs. Wondering what might be needed from the hospital or primary care providers in order to keep SNF residents in the SNF facility rather than send them to the hospital for non-emergent type situations. In lieu of COVID, we would like to minimize potential exposure.
And again, if you have any input, you certainly can unmute your line and provide any information you like. Let's see, I did have a previous question. It says, my hospital system is experiencing an influx of COVID-19 positives like many other settings and rule out patients. We're wondering if anyone has any best practices or suggestions from regulators regarding the following. What documentation must we have in the patient's chart during this time? What nursing assessments can we forego during this time? And the highest risk patients, suicidal patients. If our policy says we place them with a sitter, should we still do this if the patient is COVID-19 positive? And those are quite a few questions, maybe even just starting with how people are dealing with documentation at this point. Anybody have any suggestions? So it looks like in the chat for suicidal and COVID positive, can they do video monitoring and have sitter watching video to reduce exposure?
I wouldn't see why that would be a barrier to any other time that you would do video monitoring. So I don't know that that would be a reduction, but I would like to give another resource. This is Angie from Fairview Range. There is a call, it's called a Warm Line, Minnesota Warm Line. And this is a great resource for our patients that are feeling home isolated. So it allows for somebody who feels isolated, depressed, or anxious at home. And it's a 1-844-739-6369. That allows somebody to talk to a peer that you can talk to between 5 p.m. and 9 a.m. every night. So it's great for our mental health patients that are dealing with anxiety during this time.
Thank you. And I believe that most states have something similar to that, so we can find that information too. Let's see. So Megan Black, do you know of anything in particular at your health system, how they're handling some of those situations regarding having to adjust documentation or suicidal patients at this time?
We have several other questions in the chat. I know one is from Julie Bannister. Are members using trade organizations to successfully obtain PPE?
Hi, this is Tisha Looper. I just wanted to indicate that I know that we saw something come out from Leading Age in Michigan that they were trying to get for some nursing homes that may want to go in on a bulk order. So that was happening in Michigan with Leading Age.
And I do see this. Do you have a number of patients experiencing anxiety or suicidal thoughts in Wisconsin? Anyone? I do know there are a few people here with our home care agencies who specialize in that area in addressing behavioral health issues. And I certainly would see that that would probably be increasing at this time overall. Does anybody have any input regarding how to address patients just experiencing concerns? I know some home care agencies, patients weren't letting them in the door to provide care because of their concerns. Any strategies around
that? Barb, this is Eric. From the home care side, I can't say personally that we've experienced any of those things with the patients as far as they outside of their normal anxiety, depression, etc. Obviously, from the staffing side, we're seeing a lot of anxiety and concerns. And I know the National Association of Home Care and Hospice put on a nice webinar yesterday about just making sure that you're identifying with this, from a leadership standpoint, identifying with the staff, having the one-on-one conversations, making sure that we're updating them on why the policies and procedures continually to change, because this is a novel virus. So we're always learning something new every day, or we have the whole PPE conservation, preservation strategies that we're trying to do. As far as coming into the home, we are getting cancellations from patients more so on the senior community side, so the assisted living side. And we're seeing those change every day. So one day the facility will be on lockdown and nobody in, and then the next day we'll be getting a call because they do depend on us a lot for these chronically ill patients who need to be seen, whether it's for wound care or they're in the midst of an active heart failure exacerbation and they just don't know what to do or how to communicate that. So it changes day by day. And the biggest piece of advice I can get people is to make sure you have some type of communal tracking log on the facilities that you're entering, policies and procedures for the staff, so that they know and you know what they need to do, as well as kind of tracking potential positive or presumptive positive in your respiratory cases in those facilities, because we've been able to even identify some grouping infections in facilities that we're closely monitoring right now. So again, it waxes and wanes. Some days we have cancellations, and then the next day the patients are calling and say, I can't do my wound care, I need you to come out. So I think there may be that anxiety up front, but then once the nurse is coming out and kind of helping through that situation is definitely apparent. I'm sure most home health agencies are feeling it on that end.
And I do see, thank you so much, Eric. That's very helpful. And I do see quite a few resources being put into chat about how to reduce anxiety around COVID-19 concerns. So those are also being uploaded there as well.
Looks like in the chat, someone was hoping to get that phone number that that someone shared from that resource in Minnesota. If
I will put it in.
Thank you so much.
Mm-hmm.
Right.
There are a couple other questions in the chat. What precautions are facilities taking with mail? Some other questions kind of in a similar area. Has there been any discussion on best practices for handling linen and trash in the long-term care area? So any input on either of those questions?
Anyone from our skilled nursing facility areas or hospitals that might have some suggestions around that? And just another reminder, all of the information that's being put into chat and the questions that we need to continue to find resources on, we will send out all that information after the call as well to all participants and people who registered today. So just to make sure that we'll get that information out to you as well. That's great. So I see the Minnesota Warm Line information's been posted there. Right. I do know at our last meeting, we did talk about a transfer form focused on COVID-19 information from hospitals to skilled nursing facilities, and then that back to skilled nursing facilities to hospitals that originated from Florida. And I know our Michigan Hospital Association was working on standardizing that and getting input from that. I was just wondering, in other states, have you been working on sort of a universal transfer form with a focus on COVID-19?
If no one has an answer to that, I have a follow-up to that question though, Barb, is what we're seeing in the Southeast Michigan community coming from the health systems, and maybe Gloria can weigh in on this, because now we're getting patients who are discharging from the hospital to home with the COVID test pending. And so what we're trying to do is figure out the best way to coordinate with the hospital, because we really just coordinate right now with the discharge planners, but with the hospital on knowing if the patient is, what the test comes back as. So they're discharging with test pending, and we don't know. We are trying to push that admission out to the second day if possible to conserve PPE in the event the patient's negative and that's not as critical. Obviously, if it's critical, we're going and get downing PPE. But does anybody have like a follow-up process that they're doing from the inpatient side to communicate to the community providers if the patient is positive? Because we're not seeing it, and we have discharge planners. I don't have anyone specific, but who don't know a process for that as well.
Yeah. Gloria, do you have any thoughts on that? Or I see Janice Ramsey's also here. Janice, any input from the hospital side?
For Henry Ford Health System, we are developing a system with CarePort that should be released in the next week. Any patient or any facilities that have taken our pending patients, what we'll be doing is uploading our labs to CarePort, and they'll be matching patients. So if the ADT feed triggers that they've gone to your facility and the patient changes to positive, then we'll be sending a survey like we previously sent, but the survey will only say the patient is positive and ask you to acknowledge the result. So you would just say yes or no. And that would be a surefire way to make sure that you've received the result in a timely manner. We hope to have that system up and running. We're just processing it through our IT and their IT system in the next couple of days, and hope to have it running by next week.
Gloria, does it post a negative, like does it just post the result, or is it only positive?
So what we are doing is only triggering the surveys for positive to make sure that you are absolutely getting your positive results. You can go to Epic Care link and look, and you can continue to monitor the patient's results that way. But what we wanted to make sure is that the facilities were 110% told that they had a positive patient. What I don't want is for that survey to trigger for all change in results, and then people become overwhelmed with just the surveys triggering. I only wanted them to trigger for positive.
Okay. It's just that we'll be using the PPE on the patient, and if we don't have, is there a number we can call? I guess we can go to the Epic Care link.
Yes, for those that you're just following, I would definitely just follow on Epic Care link. But again, I'm very hesitant to have that survey trigger for negative and positive patients, simply because of the potential volume, and I don't want to overwhelm people's mailboxes in an already hectic situation.
Thank you, Gloria. I know anyone, I thought I heard someone say they were from Fairview. I know that's a hospital system in Minnesota, but I don't know if they were from the Fairview hospital system. Anyone from another state have anything that they're doing particularly?
Can you read, this is Angie. I am part of the Fairview Hospital System. We're up in Hibbing. Can you repeat the question?
Would you mind repeating? Yeah.
What were we doing in particular as it relates to?
To my understanding, it was notifying or making sure that the home care agency or referral source knew about the screening as it was pending. Do I have that right, Eric? Oops.
Getting patients who are tested in the inpatient side and discharging to home, or they could even be discharging to SNF, they're probably the same thing. And we want to know what people's processes out there for follow-up and whether the test is positive or negative, because And I think it's important to know because, again, as we talk about PPE conservation strategies, do we need to use the specific PPE on that patient? And obviously knowing if they're COVID negative or positive. So what are the hospital strategies to make sure that the community or SNF providers are alerted of the test result when it's ready?
Sure. So right now we have pretty tight tracking of all of our patients that we have tested to assure that we have timely follow-up. Again, we haven't had a huge insurgence of patients that have been under suspicion. So the volumes have been really appropriate to manage, and we would want to communicate those immediately. It's also, you know, right now we've had barriers for patients who are under suspicion or in the hospital to even getting back to the facilities. So if we've tested them, typically they're waiting for those results to come back before they accept them back in their facilities at this time. I would anticipate that that will change in the near future.
This is Gloria from Henry Ford. I just want to say from a Michigan perspective, the CDC recommendations that came out on the 23rd do not indicate that we need to hold patients for negative results. We need to hold them simply until they're medically stable. And then the discontinuation for transmission precautions is where we need the other the negative testing or the lack of symptoms for a certain period of time, but that does not impact the discharge from facility or from the hospital to facilities from the previous CDC recommendations that were just released on the 23rd.
Thank you, Gloria. Thanks.
We did get a couple answers in the chat from some of those questions that were posed earlier, kind of about how to handle garbage. And Dawn mentioned that with garbage, they continue to use standard precautions. And if we would have a case, it would be our contact/droplet/airborne precaution. So thank you for that, Dawn. And Julie Bannister put a nice resource in the chat as well about utilizing homemade masks. So if you're interested in that, she did provide a resource there too.
Right. Okay. So I do know we have a webinar coming up and some resource materials regarding socialization during this time, trying to find creative ways for relatives to virtually connect with their family members who are residents of skilled nursing facilities. I could see this potentially being even in the home setting, people tentative about vulnerable older adults and trying to communicate with them. Has anyone developed any strategies? I know within our skilled nursing facility team, they're putting a resource guide together. But anyone have anything that you found that's worked very well or creative ideas from the skilled nursing facility setting? And again, everyone is muted, so if you could just unmute yourself if you're trying to speak, or you can still put things in chat too.
So this is Julie from Wellbridge in Michigan, and we are encouraging people to use
Skype or FaceTime, to communicate with their loved ones, because visitors are not allowed into our skilled nursing facilities. So we are, definitely relying more on electronic ways. Some family members do come and wave to their loved one outside the window, especially now that the weather's getting nicer, but yeah, mostly electronic.
Thank you, Julie. Anyone finding any of those issues from the home care front or for people in the hospital? Oh, I see Dawn is saying we've taken residents to the window on the first floor so people can see each other. Okay. And we'll also, yes.
Go ahead, Barb.
Nope, that's fine.
I was just going to mention, Rachel asked, has there been any resources or instructions created to help elderly utilize the technology? I'm sure that's in reference to like FaceTime or Skype or whatever technology you're using.
Julie from Wellbridge, have you found that the staff have had to dedicate time to some of those things, or that you've established a quick guide?
So part of our activities has always been like a technology training. So, the residents that are currently in our facilities, many of them know how to use like an iPad, or an iPhone. But actually, since the hospitals are not allowing, like liaisons to come in and visit patients, we have our liaisons assigned to different facilities, and they're actually doing, visits with the residents, because the residents are also in their rooms. They're not allowed to go to the dining room or do group activities or group therapy. So just, having that extra hands on deck, going into the rooms, visiting with the residents, assisting them, maybe doing activities. They're coming up with some creative things, ways to do activities with the residents. So without, interfering with the infection control protocols.
Great. Thank you. I see Eva has joined us from the Michigan Health and Hospital Association. Eva, would you be willing to sort of give an update on the transfer form that we talked about last time? Let me see. And I think you have to unmute. Where did she go? We might have lost her. Let's see, Elena, are you seeing Eva's line?
It does show that she's on, but she is muted right now. Eva, if you want to unmute yourself.
I'm sorry. Can you guys repeat?
Sure. I was asking Eva Panetta from the Michigan Hospital Association to give an update on the transfer form that we talked about last time. I know, Gloria, you provided some information on that as well.
Yeah, I do know that they're working on it. I don't think the official new version has come out, but I do know that there has been internal discussions in regards to the transfer form regarding some of the criteria that came out on the 23rd as well. They want to make sure they incorporate that into there. So I do know that it is being worked on. I just don't know when the official release date is going to be.
Here we go. Let's see. Eva, I think I've unmuted you now. Did you want to provide any other updates regarding the transfer form? Oh, for some reason it's still not working. But I do know she was saying that hopefully next week all of that information would be incorporated and they would be releasing that transfer form to Michigan. And again, I'm assuming the other states, Wisconsin, Minnesota, have you heard anything about sort of starting a transfer form dedicated to COVID-19 in your states? Okay. All right.
We did get a really great response in the chat from Deborah Gibson on some ways that they're keeping seniors engaged. So if you're looking for a lot of great suggestions on there, she listed off 7 really great ones in the chat. So thank you so much.
Deborah. Thanks, Deborah. Appreciate that. And I know you're from the Beaumont Health System. Deborah, did you want to say anything else around that you're doing with your continuum of care there?
And I'll try to unmute you, Deborah, in case that helps. I know you said you were having some issues. I just unmuted you. So if you wanted to.
Oh, thank you. I wanted to make sure that those were listed out because, as Julie said, we're trying to keep them engaged and connected as much as possible. But at the same time, we're also making sure that they're staying safe. So we're delivering meals to their door as opposed to them coming out and dining amongst each other. Just trying to do our best to engage, but from a distance. So the ones I list are the most effective ones we've had thus far. And if anything else comes up, I will certainly share.
Thank you, Deborah. Appreciate it. Well, I do see we're coming up on about 5-10 minutes left of the session. I do appreciate everyone's participation. This expanded quite a bit from our small test, and I do know sometimes it's quite overwhelming to share in a large group, but I do appreciate everyone chatting in today, as well as providing verbal discussion on many of these topics. Again, if you have a question and you put it in chat, some of the resources are already there, but we will certainly send that information out to you as well and to all the participants who signed in today. We also are having these sessions on a weekly basis on Thursdays, Central Time at 9 to 10 and Eastern Time from 10 to 11. I guess moving forward, this was a longer session, but moving forward, we'll probably have them for half an hour and evaluate if they need to be extended. If you did not get your question answered today, we will try our very best to find you answer for your question from a quality resource, as well as it will be assigned to a future open discussion so others can provide information that they have from their perspective. So the questions that you established today will then also form what we will be discussing at future sessions as well. I do appreciate everyone's participation and time today. And again, I cannot thank you all enough for your dedication and trying to work together throughout the continuum of care for all of the patients and all of, I think, staff too. I appreciate people bringing up staff concerns because People are stretched, they're having their own personal issues as well as trying to care for others at this time. And so maybe we could extend that as also another topic for how to care for yourself while you're caring for others during this particular time period. So the resources will be sent out next week and will be included in the invite that we send to people. If you can always forward on the invitation to other people that you know, if they are not included in our list. And we also do have resources on our website, as well as this chat will be recorded and provided to people. And then we also do have upcoming webinars that will include this topic as well. So you'll be informed of those as those dates get confirmed for people. Again, I'm Barb Link, and I'm with the Superior Health Quality Alliance, I'm with the partner organization in Michigan with MPRO. We do have contact information for each individual state up on the screen now. So I'm the contact for Michigan. For Minnesota, it's Janelle Shear, and her email is there. And for Wisconsin, it's Ross Gadke. So if you had a specific question, state specific, and wanted to share that, please email one of us and we'll do our best to try and answer your questions as well. And so, you know, I see someone missed. Please know that this is recorded so you can listen to it, and we will make sure that you get the recording and information for future chats that we are going to have with this open discussion. So again, thank you all very much for our first larger session today. And if you have any input, we appreciate that as well to the structure, because this is a plan, do, study, act. We're improving as we go. So hope you all found something of interest and some resource that you could use. And again, thank you very much. And hopefully we'll talk with you next week. All right. Goodbye.